morning, everyone. I'd like to thank AIS for giving me this opportunity. These are my financial disclosures. Now, if you look at the number of cells in our body and look at the amount of bacteria in our body, actually there's more bacteria than actually the cells. And most of it is found in the GI's tract. And it's not just the bacteria. Actually, we have in the normal flora, we have bacteria, we have fungal, we have virus. And each organism keep a check between each other so that there's a perfect balance between all the organisms. And when there's a perfect balance, there's a very good that makes the whole body, it has a lot of benefits and makes the body extremely healthy. But when there's a break in balance by consuming either antibiotics, antifungal, or so on and so forth, it leads to a lot of side effects and you're prone for infection, the immunity is really down, and so on and so forth. Now, in the community, there's an increased consumption of probiotics, and the research question is, what happens to the ocular surface when you consume probiotics alone as compared to combining probiotics and probiotic fungus? So this was a prospective study where we looked at 48 eyes of 24 patients. A detailed ocular and systemic examination was done. We picked only healthy individuals who did not have any abnormality in the eyes or in the system. And what we did was we grouped these patients into two. Group one were the patients who were consuming both probiotics and probiotic fungus, and group two consumed only probiotic. And the tears were collected before the starting of the study, and then it was collected at 1 month and 3 months after the start of the study. All the tests were done. The biomarker test was done using the BioPath Finder. Basically, it is an antigen antibody reaction. And when you look at the results, we found something very interesting. In patients who consumed both probiotics and probiotic fungus had lower levels of inflammatory markers. Basically, there was lower levels of MMP9, IL-1 beta, IL-6, and there was beneficially higher levels of IL-10. And when you look at the other group who consumed only probiotics, there was higher level of inflammatory markers with IL-1 beta, TNF alpha, and IL-17A were at the higher level. So basically, by consuming both probiotics and probiotic fungus, there was beneficiary effect where it lowered the inflammation. And when you consume only probiotics, it increases the inflammation. And we really feel this increases mainly because it's when you consume only probiotics, we feel that it's creating an imbalance between the flora, and that is why it's creating more inflammation. So what was known was human ocular surface does get affected by external and internal factors. Tear biomarkers have been happening in the last couple of years. What this study adds is consuming a probiotic significantly affects the ocular surface, and consuming probiotics and probiotic fungus has beneficial effect. It reduces the inflammation, and consuming probiotics only increases the inflammation. And this has never been shown before, and is a very interesting finding what we found. Thank you so much for your time.
Thank you. Very nice. What was the cost of that kit?
So the diagnostic kit, it's about the device itself is about 10 lakhs, but the cartridges is around we're looking at 10,000 or so, man. Yeah, 5 to 10,000
per patient.
No. In the same cassette, we can analyze about 8 patients.
Okay.
Thank you so much.
Yeah, thank you.
Do you recommend probiotics for corneal?
Sorry, sir.
Do you recommend for probiotics and fungal?
So it is so what we used for the study was Saccharomyces boulardii. That works really well because a lot of times most of the probiotics in the market is just a plain pre and probiotic of the bacterial kind. There is no fungal combination. It's very rare actually. There's a fungus, but what we feel is when you give more, it's basically trying to give more food or letting the bacteria go flourish much more than the fungus, and then it's creating this imbalance. And because it's creating imbalance, it's increasing the inflammation, because the balance is extremely crucial for keeping the body very healthy.
In what kind of patients are you giving this probiotics plus fungus?
So to have a very controlled study, actually we analyzed the community as a general, but we found that a lot of people don't follow the tablets very properly and this. So we try to have a very controlled study where we made sure the patient, the people ate the tablets in front of one individual so that it's fully controlled.
So we presume that you had a baseline
Yes, before they started.
starting.
Absolutely,
and
ma'am.
then, at 1 month and 3 months
Yes, ma'am.
after
Yes,
starting.
ma'am. Yes, ma'am. So then we could see the change, and when they took the combination, the ocular inflammation reduced, and when they took only probiotics, inflammation increased, and this is, has never been documented in the ocular surface before, ma'am.
And did you do any symptomatic evaluation from the patient side or by a questionnaire?
We-
or how
we
were
did,
they feeling?
Actually, clinically, it didn't show, ma'am, because 1 month and 3 months can be a very short time because of these kind of inflammatory markers. We have to see maybe it leads to, these chronic dry eyes and other things. But clinically, when we tested it at 1 month and 3 months, we didn't find any clinical evidence. But only thing what we saw is subclinical inflammation. And a lot of patients, like cataract patients, when we see, we have screened preoperatively a lot of cataract patients. A lot of patients where you see in the slit lamp perfectly normal, and we looked at the tears, significant, almost 40% of our cataract patients had subclinical inflammation. And these are the patients, when we do the surgery, after the surgery, they keep complaining of dry eyes and this. So because we are doing double insult, there is some amount of subclinical inflammation, and then we're doing the surgery, which again induces inflammation. Then it goes over the threshold, and then it leads to a long-term problems.
Okay, thank you.
Thank you, ma'am. Thank you, sir.